All right, respiratory systems where we're at now, chapter 18. My big focus for this is just mainly the anatomy of the respiratory system, and other discussions about gas exchange, but there's a lot of stuff that this chapter goes into the weeds on that we don't need, okay? So chapter 18 begins on page 367. So, the biggest thing for the respiratory system, you guys can already guess. We've already talked about it. What do you think the biggest thing the respiratory system does for it? Breathing. What does breathing do for it? Brings us what? Oxygen is kind of the most vital chemical there is. Now, breathing also does get rid of the byproduct of all of our cellular processes, carbon dioxide. So, to summarize, the lungs and the respiratory system's biggest role is to get oxygen, get rid of CO2. That's your big summary. Get rid of oxygen, or get rid of CO2, bring in new oxygen. Rinse and repeat. So everything kind of depends on oxygen for production of energy, kind of everything we do. And the cardiovascular system and the lungs work really closely together. So this is kind of one of the first images it gives. Just gives you a big summary of kind of all of the respiratory tract. We'll go through it. But traditionally, they just break it up into kind of two pieces. The respiratory system, as far as anatomy goes, is broken up into upper respiratory tract and lower respiratory tract. So that word tract, T-R-A-C-T, tract, I kind of think of it like a track, like a railway or something like that. Our GI system does this too. A tract is just saying this is a series of tubes that kind of have a certain pathway, okay? So the respiratory system is kind of a closed system, meaning that air is going to come in here and it's going to leave here, but air itself doesn't really go anywhere else. Now, the molecules are going to get transported by red blood cells, but as far as like the air we breathe, it goes all the way down to the lungs and it goes back out there. It doesn't go anywhere else. So we don't get air in our blood vessels. We don't get air. We shouldn't have a lot of air in our gastrointestinal system. It's supposed to mainly just go this pathway, this tract, okay? And so upper and lower respiratory tract is how they break it up. So when you look at it individually, page 368 is the first look we get at this, and it starts just breaking these into parts. So nose and nasal cavities, that's the first part of our respiratory tract. This is the first part of our upper respiratory tract. And so it highlights the nose and nasal because this is how we're really supposed to breathe. When they teach you deep breathing techniques, or if you ever ran or done jogging, sort of stuff, the way to breathe is to breathe in through your nose and out through your mouth. In through your nose, out through your mouth. That's the natural way we're supposed to breathe. If you're a mouth breather, you should stop doing that. It's not good for you. I'm just joking. Mouth breather was like an insult in like grade school, whatever. So nose is where we're supposed to breathe. We're designed that way. Why? Well, the nose structure itself. It's a big mucous membrane that's full of mucus and cells that have, remember cilia? Remember that? Somewhat part of the cell cytoskeleton. Cilia are just hair-like structures off the cell itself. They kind of help to direct airflow, but they help just to catch debris. So a lot of our nasal cavity is there. The things that our nasal cavity does for us, to summarize it, basically is this, when we breathe through our nose, it warms and moistens the air, okay? We want our air to be the same moisture level and around the same temperature as our body. You ever been out on a really cold day, right? You breathe in, it kind of hurts a little bit, doesn't it? Mm-hmm. Right? The air is really cold. So we have a certain body temperature. Our nose does that for us. Humidifies, which means that's moistening, and kind of regulates the air temperature going in. And we want to do that. That's why we breathe through our nose. It helps do that. And it helps stop and catch dirt, dust, debris, pollen. It catches stuff in our nasal cavity, okay? Catch dirt and debris. So that's what the conche is, how it's kind of spelled, like conche or that sort of stuff. Yeah, these ridges right here. That's all I was trying to do at the start. Those ridges, that's it. Those conche, they're ridges that kind of help direct airflow. And they're kind of important only because if our whole nasal cavity was just smooth, the air would kind of just get in here and then like bounce around, so to speak. But these ridges kind of help direct that flow in a certain pathway all down to the back of our nose, where we want the air to go. We don't really want air bouncing around in our nose. We want it to kind of have a certain directions flowing when we breathe in. So that's your first structure, is just nose or nasal cavity. If I say nasal cavity, it's kind of saying the whole nose, because as soon as I'm into each nostril, I'm in the nasal cavity. So the next structure in the respiratory system is upper respiratory still. We're still talking about upper respiratory. That is my pharynx, is how that's pronounced, pharynx. So pharynx is the next structure. Basically, how I always summarize the pharynx is this is the back of your throat. The pharynx has 3 sections to it, and they make sense when you think about them. So the first section, where the nose meets the back of your throat, nasal pharynx. So that word's in there, nasal and pharynx. Nasal pharynx together means this is where my nose is meeting the back of my throat. What's the middle one? Oral pharynx. What's the word for my mouth? Oral. So oropharynx is where my mouth meets the back of my throat, right? And then the last section of the pharynx is called laryngopharynx, because guess what? The next structure that's after this is called the larynx, which we're about to talk about. So that's all the pharynx is. It has 3 sections, mainly just saying that, guess what? Air should only pass through the nasal, yes, air is going to pass through the nasal pharynx, all of it, but guess what? Food and liquid shouldn't ever go. Probably in the nasal pharynx, right? Have you ever been a kid and you said something funny and milk squirted out your nose at the lunchroom, that kid or whatever, right? That's because those cavities are tied together. Remember our eustachian tubes in the ears? They're all tied together for pressure and for air movement. And so food should definitely pass through your oropharynx and laryngopharynx. It should pass through that section, but food and liquid should not be passing through your nasopharynx, okay? Anatomy-wise, should that be going up your nose towards your nasal cavity? We don't want that. And if you ever went to school with a really weird kid, they would show you how they could like cough and pull a spaghetti noodle out their nose from their mouth, or vice versa. You can do that. That's gross. I don't know why you would, but you could. Maybe I went to school with some weird kids. I probably did. Yeah. I was probably one of those weird kids. All right, so that's the pharynx. It has 3 sections. So the next structure that's part of the respiratory system, so it goes nasal cavity, pharynx, larynx. Larynx is the next structure, which has a little bit more complication to it. That's page 369, is the larynx, okay? The larynx role, the book kind of highlights it. Prevents food and liquids from entering our trachea. So the trachea is what we're going to talk about next, but the trachea is your AKA windpipe. That's where you want this air that we're breathing in to go. Guess what you don't want going down your trachea? Because guess what's from your trachea? Your lungs. What do you not want in your trachea? Food and water, right? We just want air there, okay? So there's a structure that's in our larynx called the epiglottis. That's what I would highlight. Epiglottis is on the left-hand side of the page in bold letters. Try to highlight it for you. So in the larynx is the epiglottis. And what the epiglottis is a connective tissue muscular structure. It's like a flap. You see it? It's got the shape of like a flap here. And this flap, whenever I'm talking right now, this flap is open. So air passes through. But as soon as I go to take a drink of water, what can't you do while you drink and eat? Talk, right? You ever tried to? What happens? Yeah, you choke, right? That's why you tell kids don't chew and talk at the same time. You know, it's not because chewing with your mouth open is nasty. It kind of is, but it's also because you could choke. That's what happens when you accidentally say, "Oh, a wrong pipe." You choke on liquid. It's because you're kind of talking or moving air at the same time you're trying to swallow. So when I'm talking, this is open. When I'm trying to drink my coffee or eat my food, the epiglottis will fold down, blocking like this, blocking that route to the trachea, so that food and liquid flow over it and go to the other tube that's in my neck, which we'll talk about with chapter 21. The esophagus. Behind the trachea is the esophagus. This is my food tube, okay? That's on the way to the stomach. I don't want A computer just pulled up the Microsoft store for some reason. Okay, cool, whatever, get out of there. I don't want food, or I don't want food or water in my trachea. That's supposed to go behind it. So the epiglottis is the structure in the larynx that allows it to fold over and let food and stuff pass over the trachea and not get into my airway at all and go to the esophagus. So anatomy-wise, the front, the most anterior, there's two tubes in my neck. The most anterior tube is called the trachea, which we're going to talk about next. That's on the way to the lungs. The larynx and trachea are anterior. Posterior, behind them is my esophagus, and that's the tube where my food goes. So out of all the other structures, I wouldn't stress about knowing names of anything else except the epiglottis. The reason is, a lot of times people that are, if you maybe noticed this, if you work with the geriatric population, elderly population, older people sometimes have trouble swallowing, right? Some of you notice that. Why is that? A lot of times it has to do with this epiglottis. The epiglottis is a muscular connective tissue piece. And so what gets weaker the older you get? Connective tissue and muscle. So the epiglottis gets a little weaker and not as responsive. Sometimes it doesn't always make that fold very well over top the trachea. And people can do what's called silent aspiration. That's a good name for that. If you hear that word, aspiration, A-S-I-P-I-R-A-T-I-O-N, aspiration. Aspiration is the word we use for when food or liquid get into my airway. They're supposed to go over the epiglottis and in my esophagus. They get in my airway. That's called aspiration. I don't know the book actually uses that word, but it's not a bad one to have an idea. That's your main structure of your larynx. Your other main structure of the larynx. Anybody see it there? Huh? Well, the trachea is its own structure after the larynx. So this whole section here really is like my larynx. There's something in here that's really important for what I'm doing right now. Huh? Vocal cords. The ability for me to talk is my vocal cords. So my vocal cords are housed in the larynx. And you can see the picture of them at the bottom of 369, but vocal cords just, all they are flaps of muscle and connective tissue that produce sound because air moves over them, vibrates. So that's why if I talk like breathe it in, like it's gonna, that hurt me. It's gonna be a different sound almost than a normal talk. And normal talking is pushing air out usually, but that's what vocal cords do. They produce sound. So that's why they call it, if someone has inflamed vocal cords, what do they call it? Anybody know this? Laryngitis. Well, we know what itis is, right? Inflammation. So laryngitis is just inflammation of the larynx area or the vocal cords. Does that make sense? So the two main structures, the epiglottis is kind of the start of the larynx. The epiglottis is kind of the start of it. And then housed in the larynx is my vocal cords. So the big rule of larynx, it says, you can see up top of page 369, it says, prevent food and liquids from entering the trachea. Epiglottis' job. Acts as a passage for air from the pharynx to the trachea. Yeah, that's pretty obvious. It's on that track. And then it produces sound. So epiglottis, vocal cords housed in the larynx. So again, if I have hoarseness or issues, that's probably laryngitis. That means that my vocal cords are inflamed. This is just an anterior picture kind of showing you. There is, I will make this point, you don't have to necessarily know the name, but there is cartilage in front of our trachea. These bands of cartilage here. And you can see that in your book. Why do you think we have these round bands of cartilage around our trachea? Todd's got it. To protect it, right? So the trachea is in the front of my throat, right? If that's the main pathway, the only pathway in and out for air, I need to protect it. So if it was just soft connective tissue or muscle tissue, it can be pushed in pretty easily. Those cartilage bands help kind of give it some structure and protect it from being crushed. But a lot of times, this is a sad truth, but if someone was murdered, like choked to death, they can tell because the trachea will be, a lot of times the cartilage and everything will be crushed in. So they're saying, okay, that's how they died because their trachea is completely crushed in. They were suffocated. They were choked to death. That's how they would know that. And that's why some of those karate movies say, yeah, right in the throat, that could kill someone, okay? They actually teach special forces a technique for killing someone that way, if you're curious. So, anyway. So, structures of the, you go away. Can you just get out of the way for a minute? Be gone. Still fun. All right. Well, the lower respiratory tract starts on page 370, and that starts with my trachea. So to summarize, right? Upper respiratory system, nasal cavity. What's next? Pharynx, larynx. Once I'm past the larynx and the vocal cords, I'm now in the trachea. The trachea starts what's considered the lower respiratory tract. So it goes trachea, and then there's a bunch. What they basically call them is bronchus or bronchi for plural, and then the lungs themselves is the whole picture. So if we look at the picture, why is this staying up? I can't figure that out. I don't need you to stay. All right, whatever. This is the picture on page 370. So how it basically goes is I just look at it like three structures. I just keep it simple. Just like the upper respiratory tract is three structures, I'll say the lower respiratory tract is three structures. So number one, trachea, the tube that connects the larynx to the lungs. Number two, I just call them just bronchi in general. So bronchi are the branches, okay? So all these branches here are bronchi. They just go from big to small, basically. A lot of people look at the lungs like an upside down tree, and you can kind of see that, right? Where the trachea is the trunk, and then the branches of the tree are the bronchi branching out throughout the lungs. And they go kind of from big and thick at the trachea, and they get smaller and smaller until they become microscopic. The other structure would be the kind of summarizing the whole thing. The whole thing, when I get through the bronchi, are my lungs, which is these guys here, this whole structure. So what the lungs are is tissue-wise, the bronchi are hollow tubes that start big and get smaller and smaller until they become microscopic inside the lungs. The lung tissue around them is all about helping. So breathing is a process that really requires the air movement from through my mouth, through these structures to the very smallest portion. And inside the lungs at the very microscopic level, these bronchi are going to terminate, meaning they're going to end somewhere we call alveoli. We're going to talk about alveoli next. So basically, it's basically just saying trachea, bronchi, and there's a bunch, they tell us there's a bunch of different bronchi, like primary, secondary, tertiary, bronchioles. Who cares that much about that? I would say that if you're thinking about bronchi as the big branches, the smallest pieces of that branch are known as bronchioles. Like bronchioles is right before we become microscopic. That's a good note. Bronchioles are what they call the tiniest little branches of the bronchi right before we're getting kind of microscopic inside the lungs, okay? One good point to make here, and this is a good nursing thing. So look at the difference between these bronchi real quick as far as their anatomy. So the right bronchi is pretty vertical. You see this? Where the left bronchi is a little bit more like lateral. You see this? I have a little bit. This one's a little bit more like this, like so deeper, a little bit wider, a little more lateral. Why am I bringing that up? If I accidentally swallow a food or a coin, even, or whatever, and it ends up in my airway, look which lung it's likely to end up in. The right side, okay? Because it's a wider, more steep branch. It branches off and to the right. So a lot of times when people have what's called aspiration pneumonia, they get pneumonia because they've aspirated, they've swallowed food or something like that. A lot of times it's the right side of lung pneumonia. Ends up affecting the right side mostly because it's a lot easier. Food and anything that gets passed into my lungs is not supposed to be there, will likely end up in the right side. And that's a need to know because that's a nursing thing. So it makes sense why a lot of times some people have right-sided pneumonia from aspirating, from food. Food gets down there, it's going to end up in the right side more likely. It could end up in both sides, but the right side's the culprit. And the book makes that point somewhere. I don't know. It is somewhere, I swear. I promise. Dagnabbit, it says it somewhere. I'll find it. Oh, right there. Bronchial tree. And it talks about the two primary bronchi, left and right branches. At the bottom of that first section about bronchial tree, the right bronchus is slightly wider, more vertical than the left, making it most likely location for aspirated, parentheses, inhaled, that's what that means, food particles and small objects to lodge. So those are the main structures of our respiratory system, upper and lower respiratory. When I get down to the smallest bronchioles inside the lungs, I have this guy. And the way you pronounce this is like Al, not Yankovic, but Al V, maybe. I don't know. Most people say like alveoli. They don't even put the O kind of in there, alveoli, but it's alveoli. Alveoli. These are, so we have these microscopic, really small bronchioles, and they end in all these balloons, these sacs. They call these like alveolar sacs or whatever like that. These are just sacs. So they're filled with air still. So the book gives us a fun fact to give you a perspective. It's estimated that the lungs contain 300 million alveoli. 300 million. So it's a lot. So we're talking very microscopic, very small. So what the alveoli do is this is where the gas exchange happens. So they're showing us here that you can see that, remember our pulmonary circulation that's coming off our right side of our heart, heading to the lungs, right? To get oxygen, yes? Okay, right side of the heart, sending oxygen, poor blood to the lungs, that's called pulmonary circulation. This is those capillaries that come from there. They wedge around the alveoli, and this is where gas exchange happens. Alveoli is where gas exchange happens, okay? Alveoli sacs is where the action happens. So what they're showing us here is that every time you kind of breathe in, these sacs kind of move with you. So when my lungs are full of air, the sacs will be a little bit wider and full of air, like balloons. And when I'm exhaling, the sacs will get a little bit smaller and less compressed. So they're a very elastic connective tissue, and they're very thin, like single cell thin, light blood vessels, because we want blood vessels to attach to them. We want very easily for this to happen. We want very easily for the gas exchange that happens. So all these millions of alveoli have millions of these little capillaries on top of them. And this is what happens. The red blood cells passing through this tiny microscopic capillary, and the lung alveoli are full of oxygen. So it says, hey, lungs, here's my carbon dioxide, and I'm going to take the oxygen molecule, and then I'm going to go head back down to the heart and to the left side of the heart and get pumped to the bottom. That's what's happening in the alveoli. That's what they're talking about on page 371. They're just talking about the alveoli are these thin sacs. That's where the gas exchange happens. Make sense? Yes. Okay. You don't have to get too much in the weeds other than that, okay? So page 372 is talking about the lungs in general, like what they look like. The only big note I want to make here is the lobes of the lungs. So I can't figure out why you're staying, but you're staying, I guess. So the lungs are divided into lobes. It just means that they have some tissue that kind of divides them into sections. The reason it's important to know the lungs have different lobes is because of where you would listen. Like if you're going to listen with a stethoscope, okay, you actually need to kind of listen to all lobes, because sometimes they're like little separate branches of the bronchi, and sometimes there can be an infection and build up in fluid or something in one lobe that doesn't really, it's not in the other lobe. And it's usually gravity dependent. So a lot of times when people have infections or fluid in their lung, it's going to be on the lower portion, right? Because gravity, I'm standing, so kind of everything settles towards the bottom first, right? Just like in a pool or something everything settles on the bottom, it's gross. That's where it settles. So the right lung has 3 lobes. 1, 2, 3. The left lung only has 2 lobes. 1, 2. That's all I'm saying there. That's just memorization. Right lung has 3 lobes. Left lung has 2 lobes. So if I'm listening to someone with a stethoscope, technically to be a full nursing assessment, you're supposed to listen front and back, okay? If I'm listening in the front, I've got, basically you're listening in 3 places on the other side, but you got to make sure and get on that right side, you got to get to the lower part of their lung and listen to that last lobe. Same thing, most time when you're listening to someone's lungs, you'll learn this the first trimester, you're supposed to listen front and back. So I listen in the back too. 1, 2, 3, technically 1, 2. I need to listen to both lobes on the left-hand side and all 3 lobes on the right-hand side. So really like 5 places I need to listen. Look what's here too, though, the diaphragm. Diaphragm's in this picture as well. And that's what it's on source of cherry somewhat. But the diaphragm is the big muscle. That's the main muscle that helps me breathe. We're going to look at how we breathe in a second. That's what the rest of the chapter is talking about. How do we breathe? So they talk about this. Remember the heart had a base and an apex, right? Remember that? Okay. Lungs have the same thing. It's just flipped a little bit. So the base of the lungs, where my finger? The base of the lungs is up top, okay? Or excuse me, the base of the lungs is on the bottom. It's opposite to your heart. So here's the base of my lungs. Each one has its own base, right? Its widest point. Here's the apex. And you can actually see your lungs, both of them a little bit, run right up above your collarbone, which is also known as your clavicle. Do you remember that? I'm trying to see if you guys remember. I was hoping someone would say it. Clavicle. They both run up a little bit above. So again, we're still looking at anatomy. Below your lungs, underneath the base, that is where your diaphragm is. The big, huge muscle that kind of divides your whole thoracic cavity from the abdominal cavity below. And you can see our main artery and vein kind of run through here behind the heart. They go through the diaphragm. The diaphragm is the main muscle we use for breathing. So I'm saying that now, but I'll say it again. Main muscle we use for breathing is the diaphragm. So there's some life lessons we should be introduced to in this chapter. One of them is asthma down there. On the bottom of page 372. I have asthma. Who's heard of asthma? A lot of us have heard of asthma, right?
Yes.
Okay. Asthma, most chronic disease in childhood. I try to make a slide that just summarizes this.
Something like that.
Yeah, write that one down. You want to know what asthma is. But this slide should, again, I updated chapter 18's PowerPoint to have this slide in it where it's just, let's get it, basically 3 things. Most common childhood disease, airways become inflamed, and then they hyperreact to triggers is what they're doing. So pet dander, pollen, dust, cold air, and exercise are all stuff that can kind of induce asthma or that sort of thing. And what happens is all of our bronchi in our lungs have bands of muscle on them. And when everything gets inflamed and hyperreacts, that band of muscle kind of closes down and the bronchi spasm. So what asthma is a bronchial spasm. That's what asthma is. So what they're showing us here is that a normal open bronchi should kind of look like this. An asthmatic bronchi is all inflamed, and look how tight the opening is. And that's what causes wheezing. That's why asthma is associated with wheezing. The wheezing is that what you hear when the air is rushing against these tight bronchi, okay? So they treat asthma with steroids, inhaled steroids, inhalers, albuterol, like the tried and true one. But this slide has the main points for asthma. If you hear asthma, most common childhood, what is it? Hyperinflamed, constricting airways, reacting to things like dander, things that react, like allergic things, and exercise too, and then they're just closing in. That's what it looks like, okay? Summarizing that life lesson of asthma. Okay. So one thing we mentioned before, way back when, I think chapter 5, I want to say. I don't know why this won't go away, but I'm just going to move it out of the way. Way back in chapter 5, we talked about membranes around our organs. We've mentioned some of these. Our heart has the pericardium, big double sac membrane. There's membranes around our body cavities. There's membranes around a lot of stuff. In this case, we have a membrane around our lungs, both lungs, called pleura. That's what this is called, pleura. So membrane around the lungs, pleura. And so what they're showing us from this picture is that our lungs are encased in this membrane. Another double-walled sac membrane, just like our heart. Again, the double-walled sac with fluid in the middle. What does that do? Helps reduce friction. Because our lungs, just like our heart, do a decent amount of movement, right? I forget how many times we breathe in a day, but just as you're sitting here, you're breathing several times a minute, all day, every day. So there's a lot of expanding, contracting of your lungs to do that breathing. And so we want to have them have a sac around them with fluid, prevents friction, so they can expand and contract and not cause issues with them attaching to the rest of our body. Problem with that is has anyone ever heard of a lung collapse before? Some of you have. You've probably seen them in the TV shows and the movies and stuff like that. Lung collapses happen because of this issue. And so we're going to talk a little bit about, the next section talks about what the lungs are. For all you need to know for right now for pleura, is that pleura is the name of the membrane covering the lungs, okay? I will make this point because this is helpful. It does have two layers with fluid in the middle. The layer that's physically touching the lungs, okay? The layer that's physically touching these lungs is called visceral pleura. And visceral usually is always talking about an organ, okay? Like organ side. If you remember a little bit, technically our pericardium, I didn't go into depth on that. Technically our pericardium has a visceral side layer and an outside layer. So the visceral is always like organ side. What's physically touching the organ? And then the outside layer is parietal pleura. Outside. This is what's touching, like, what's attaching our lungs, okay, to the thoracic cavity on the inside. So the visceral pleura attaches to the lungs itself. Parietal pleura attaches to the outside and kind of holds our lungs in place in the thoracic cavity. Why am I making that point? Because lung collapsing, this is why I'm making the point. So page 373 has what's called, talks about lung collapse. Wait, what was this? Was it a video? No, it was an audio. Oh. No. So pleura is the name of the membrane around our lungs, two layers, viscerals on the inside, parietals on the outside. And they call that in between, like the fluid space in between the two layers, they call it a pleural cavity because it is like a cavity in between the two. And it usually gets bigger as my lungs kind of expand or they shrivel up when I'm breathing in, breathing out. It'll kind of make that cavity a little bit bigger. And I want to talk about that bottom life lesson in a second. Refreshing. If I inhale food or a foreign object, it's most likely to lodge in which part of the respiratory tract? Pharynx, right bronchus, left bronchus, or the bronchioles, which bronchioles are the smallest, tiniest part of the bronchi. Right, the right side. That's just something I think is a nursing thing you don't want to forget, so I'm putting it as a need to know. I put it as a question. It's right bronchus. The right bronchus is a little bit more vertical and a little bit more of that. Right bronchus, more vertical, a little bit wider. That's where food and objects usually ended up. Okay. So this is a slide I added, but this talks about the life lesson at the bottom, pneumothorax. So one thing about the lungs that's hard to understand, we're about to talk about, is the lungs are a negative pressure system, okay? Our system that's in our lungs is negative pressure system, okay? Okay, what the heck does that mean? Negative pressure system. What that means is that we're going to talk about lungs and how they breathe. How they work is a lot about the pressure in the world around us, okay? Our lungs function because they are pressure different than the atmospheric pressure outside of us, okay? So let me just give you a picture of this, right? If you think about this. Traditionally, our lungs are operating negative to the pressure, meaning like they're lower than the pressure around us. So let's just say outside my lungs right now, this room we're in, there's all atmospheric pressure. It has to do with the world's gravity and all that stuff, okay? But just humor me. You don't have to be a scientist totally to understand this. Let's say the world's pressure is like 1.0, okay? That's the atmospheric pressure. We inside our lungs are called negative pressure, meaning like that we're not actually negative. It's just we're lower pressure. Our lungs operate on a lower pressure than this, okay? So I'm just making numbers up, but this we'll just say 0.5 is what's inside the lungs. So what a pneumothorax is, that word, pneumothorax, because there's a couple words. Pneumo has a lot to do with lungs. This PN, this pneumo is like lungs, because what's the word for a lung infection? Anybody? Pneumonia. Pneumonia. Pneumonia is the word for lung infection. So lungs have a couple double words of pulmonary or pneum something. P-N-E-U-M. Okay? Pneumothorax or something with the lung. So what a pneumothorax is, the definition, to be simple, is to say basically, okay, pneumothorax is a lung collapse. That would be kind of like how I would describe a pneumothorax. And kind of going back to the pressure discussion, our lungs operate on a negative pressure system. So what happens is a lot of times pneumothorax happen in like accidents, car accidents, something like that. Something happens. My thoracic wall is punctured, meaning like outside. I was in a car accident and my rib broke or something, or maybe I got stabbed right here in my chest, okay? And it pierced my skin into the lung tissue, all right? Or into the wall of the lung, something like that. So lungs are a negative pressure system, which means they're a little bit lower than the atmosphere pressure. So just like we've learned about with concentration gradients and stuff like that, pressure is one of those things that always kind of wants to equal out. So if all of a sudden my lungs are encased in my chest, they operate negative to atmospheric pressure, but now I have a stab wound or something that's putting a hole in my chest. Well, what is the pressure going to do? It's going to rush in because it wants to equal out this number, basically. It wants to kind of equal out the pressure with inside my lungs, with outside the lungs. My lungs and my muscles help me manage this, but as soon as there's an extra opening, I can't account for that. So air rushes in, and air might get trapped in the pleural space. And now, instead of a little bit of fluid, there's a bunch of air that's just going to continuously rush in to the point that it compresses the lung until it collapses. That is a pneumothorax.
Oh, so isn't why like when people have like a gunshot or something?
Yes. So that's why you see in the movies, if there's like something they say they have a lung collapse or a pneumothorax, what they're doing with putting like a straw or poking another hole is they're trying to equal out the pressure. They're trying to like, there's a hole that's letting all this pressure in one spot. They're trying to equal it out by giving it basically an escape hole. So if a bunch of air fills up, I can put another hole and it's going to kind of level the pressure out. Now, that's not a long-term solution. That's just to kind of reinflate the lung. But then they got to do a lot more. They got to fix the hole that started the whole problem. But that's what a pneumothorax is. The summary of a pneumothorax is a lung collapse. Typically, some kind of injury has caused pressure and stuff to build up, and pressure rushes in, fills that space that's normally just a double-walled sac called the pleura, fills it with air, and the air pushes down the lung, collapsing it. Because the lung's kind of like a balloon. It's mostly filled up with millions of alveoli, which are filled up with millions of volume of air, okay? That's what they're showing us. So I would advise reading on that. I don't have time to go into depth of that. But so let's talk about the lungs and how we breathe. Negative pressure system again. That's kind of my next discussion, is like, how do we breathe? What initiates this problem? It's the pressure in the world around us. So skip anything that talks about lung microbiota, anything about microbiology, microbiota, you can skip that stuff, right?